Welcome to Business Notes, the show where entrepreneurs tell their stories of struggles, strategies, and successes. I'm your host, Diane Bogino. It's a pleasure to welcome my guests today, Brittany and Nick Perslin. The Perslins own a telemedicine company called No Limits Medical. No Limits Medical is a company specializing in hormone optimization, sexual health, weight loss, hair restoration, and anti-aging solutions. Nick is a retired law enforcement officer with over 20 years of experience and is the CEO of the company. And Brittany is a nurse practitioner with over 20 years of experience and is the chief clinical officer of the company. Brittany and Nick, welcome to the show today. It's a delight to have you.
Well, thank you so much.
Thanks for having us.
Yes, absolutely. Now, there's something I've been curious about ever since you started your company, and that is how did the name No Limits Medical come about?
Well,
we were searching for a name, and we didn't want something that was cookie cutter or like a lot of the other medical groups out there. They're doing what we do. And we kind of thought, well, what is it that we do different than everyone else? And the thing that we do different is everything. We do everything. We don't really put limits on the medical care that we can provide. If we can provide it, we do provide it. And that is the main difference between us and other HRT, wellness, longevity medical companies.
right. So, we wanted to stand out from your average HRT company. And by doing that, we opened up the amount of products and services that we have for patients. So that's where No Limits kind of came in. Hey, we have no limits on the type of HRT and telemedicine care that we can provide for patients.
Ah, great. So tell our viewers a little bit about what type of care and services you do provide for your patients and why it's so important.
So the main staple of what we do is hormone optimization. And we always say hormone optimization and not hormone replacement because we want to optimize hormones. We don't just want to replace them. We want you at good high levels so that you're getting good benefits. We dose things a little bit different than the average provider based on, a lot of experience and science. But we also offer peptides and what other kinds of stuff?
I mean, every form of wellness and longevity
Right.
and biohacking, which has become really, really popular space in the medicine world, but a lot of other companies just don't do it well. They understand one piece of it, but they don't understand the rest. So, maybe they'll have some of the HRT down, but they don't know anything about peptides, or they don't know anything about the longevity area.
Right.
So, we supply those services in abundance and all kinds of genetic testing and lab testing that other companies just don't do.
Mm-hmm.
GI mapping, everything.
And why it's so important is that, we want you to not only live a long time, but we also want you to be functional for that amount of time. We don't want you to live to 99 with 20 of those years being an invalid. So we want to optimize health. We want to reduce the risk of long-term disease, cancers, osteoporosis, Alzheimer's disease, all of these things that are debilitating later in life. Those are the things that we want to prevent. So we're true preventative medicine, not just, hey, we're replacing a few things.
Because patients have been hardwired by their primary cares that they're just there to fix something. They have to be rewired into thinking that they're not necessarily with us to just fix something. They're here to maintain their health for a very long time.
Right.
They're not just here to fix a problem.
Well, that brings me to my next question, which is what does make your clinic better than someone's primary care provider? And for those that are not in the medical profession, HRT is
hormone replacement therapy.
Okay, great. So why are you guys better than someone's primary provider?
Well, there are so many providers out there who simply don't understand hormones. They have had no training in it, and it really is a specialty area. I always tell people it's like, you wouldn't go to your dermatologist for a surgical problem. It's not because that dermatologist is a bad provider. It's because that's not their area of expertise. This is our area of expertise. We've had high level training in hormone optimization for both men and women, peptides, wellness care, preventative medicine. So, the traditional medical model is you've got a problem, we fix it. Sometimes we fix it well, sometimes we don't. We're not really here to make you better. We're here to help you complain less about the symptoms. And that's not us. What we want to do is actually improve your health. It's just like people who put these good smelly things in their house to make it smell clean. What actually is better is your house actually being clean so that it smells clean. So that's the way we look at medicine. We are here to actually make you better and improve your health, not just cover up the symptoms.
Mm. And what types of populations do you serve in terms of your patients, and what states do you operate in? I know I always operate in the state of confusion, but I'm sure you're better than
we
that.
operate there sometimes.
We operate in basically all 50 states to a certain level.
Yes.
Some states are a little tougher with telemedicine, what you can do telemedicine, but we do provide services in all 50 states to this day, right? I think
Yeah,
we're 50 states.
So we have an RN coach that works with us, Courtney Cash. She's wonderful. So, some level of things we can do in every single state, whether it's just coaching or just non-controlled substances. Some states are a little bit tougher with the controlled substances like testosterone. So there's a handful of them out there. We recommend that you write to your local representatives to improve access to your care in your home state. But we pretty much work everywhere. And there was another part of that question. What was the other part?
Oh, well, what populations of patients do
yeah.
you serve?
So we take care of both men and women, which is also a little bit unusual in this kind of space. Usually providers will specialize in one or the other. And we also do all ages. A lot of HRT companies won't touch you if you're under 35. We have patients that are 17, 20, and we provide age appropriate care for those patients. So, there's young women out there dealing with PCOS. They can't get help because no one wants to help them because they think they're too young, so we fill a niche that a lot of providers just don't provide for patients.
Yep. We have a patient in his 20s, he's a law enforcement officer. And if you look at his blood work, he has the hormones of an 80-year-old man. So, he needed help, but a lot of other clinics would not touch him because he's under 35 or under 30. It doesn't make a difference how old you are.
If you need help, you need help.
If you need help, you need help. So he's on a little bit different protocol than the normal person with us, but he's having great results, feels great. His latest blood work is fantastic.
Yeah, it is. And, we take care of a lot of law enforcement people, firefighters, first responders. As you probably already said, Nick is retired law enforcement. So we have a very special place for those patients. They do need more hormone optimization than the average person because of their intense stress levels that they have. And that constant bombardment of cortisol really decreases your hormone production earlier in life than it does for the average person. So those people need special help, anyone in a really, really high stress job like that. So those people, they need more than just the average protocol.
And when people come to us, we're also reevaluating the stuff that they're on. Like their protocol from their primary care, may not be what is in their best interest. A lot of times. So we will take them off medications and put them on better things for them. We do that all the time.
You have no idea how many times I ask patients, I'm like, well, why are you taking this? And they're like, I don't know. My doctor just gave it to me.
Right.
We
just had this happen. We asked somebody if he was on a statin. He said, nope, I'm on a blood pressure medication. Well, it comes out that he's on a medication that is both a blood pressure medication and a statin. He had no idea.
And he was having side effects.
Yep. And had been taking it for years and had no idea that he's taking a statin.
So we gave him some better options.
Yeah.
Great. And what types of blood work and diagnostics do you do, and how do you get the blood work? I can't send it through my.
Well, maybe that's coming in the future. So another thing that makes us stand out from, the average HRT clinic is that we do comprehensive labs. So we do a CBC and complete metabolic panel and
What's the CBC? Sorry.
complete blood count.
Okay.
So we look at comprehensive labs, not just your hormones. Most clinics will just send you a kit in the mail that looks at 5 things. It's not accurate. So we actually send you to the lab. So we'll send you to LabCorp or Quest to get the labs drawn. Those results will come to us. But we catch all kinds of things. We've caught thrombocytopenia. We've caught pituitary tumors. I mean, we catch.
What was the blood disorder?
Hemochromatosis we caught last week. So we catch all kinds of things that your average HRT clinic is not going to catch because
and all of these patients are going to a primary care, right?
Right.
They have care and they're not catching these things.
Right.
Wow. Scary. So how experienced are your providers in hormone optimization and the wellness space, and what does hormone optimization do for your patients?
So hormone optimization is, first of all, going to make you feel better. It's going to give you
Okay.
better energy, better motivation, better sexual function. But again, it's also reducing the risk of long-term disease because having your hormones at good high levels helps to reduce the risk of a lot of long-term diseases. Women went through a big scare with estrogen based on a really bad study that was done, the Women's Health Initiative. So many women were really scared off of hormone optimization or hormone replacement. And in the aftermath of that, we saw huge increases in osteoporosis and fractures and death from fractures and all types of things that are prevented from having your hormones at good high levels. So you have to understand that there's a difference between bioidentical hormones and non-bioidentical hormones. The non-bioidentical hormones is what the Women's Health Initiative study was looking at, and they do have increased risk for a lot of things. So we only use bioidentical hormones, and that means that your body already knows what those hormones look like. It's the hormone, the same structure of the hormones that are already in your body.
The synthetic or non-bioidentical had a relationship with cancer.
Right.
And that is true. The bioidentical forms do not have any link to cancer. In fact, the opposite. They help keep cancer at bay.
Mm-hmm. And we also do all types of testing. We do GI mapping. So we look at, a lot of types of GI issues which a lot of people are struggling with and not getting help with. We do autoimmune testing. We do genetic testing. We just did a few genetic tests on a guy and got some really interesting information on, things that would be great supplements for him, areas that he tends to be deficient in. It's interesting stuff.
If it can be tested, we can test it.
Wow. So Nikki, you were a police officer, and Brittany, you were a nurse. What made you start this business?
Well,
we're not sure.
She was already working in the space for years. And I have been on HRT myself since I was 36. So, we're 18-ish years in with me. And I like to learn about the things that I'm doing. So I knew quite a bit about the male HRT side of things. And a lot of the peptide side. So after she had been in it for a few years, we were just talking every day about what the business model looks like and how that particular company was not really serving their patients appropriately. They were doing very, very minimal blood work with a blood spot kit that was really, really inaccurate. They weren't providing medications that they should have been providing or could have been providing, instead just passing off a medication that they were getting cheaply from a pharmacy that they were doing business with. So they just were not doing it the way we thought it should be done. And we just decided that we were just going to go off and do it on our own.
And do it better.
And we did not have any idea how hard that would be, because it is extremely hard to get into the telemedicine space, especially now, and not just get into it, but get into it in such a huge way that we did with all of the things that we provide. We're a total wellness company. We're not just HRT, and that's a list of medications that literally is a few thousand long.
Yeah. And, my experience is I spent a lot of time in emergency medicine. I spent a lot of time in pediatrics before that. Feels like a lifetime ago. But I've been working in hormone optimization for at least 6 or 8 years. But all of our providers have had very high level training, specifically in hormone optimization, wellness, peptides. So we've gone way beyond, our regular education. But like Nick said, we've seen how it was done badly. So we wanted to do it right. And part of that is using several different pharmacies. A lot of these companies only use one pharmacy because it's
and they'll only use 3 medications,
right?
Just so they can streamline it in a way that's very, very efficient. We are not nearly as efficient in that way, but we provide a much larger set of services than they could.
Right. So, our patients might have products coming from 3 or 4 different pharmacies, and that takes a lot of time and effort. But that's fine, because that's the way we want to do it. We want to be able to provide a array of things.
We are never going to be that company, that cookie cutter company you go to, you get your quick labs in the mail, you get your testosterone or your couple things that they have, and then they don't talk to you again, because that's kind of the business model of most of these other clinics. And really primary care too is very similar in that way. They will put you on a cookie cutter protocol and say, see you in 6 months or a year, whenever your insurance will pay for another office visit. Where with us, once you are a patient with us, a member, you can see your provider anytime you want for free. So,
well, that's one thing I wanted to ask you about for our entrepreneurs in the audience. Number one, how difficult is this business to start? And number two, I wanted to ask you about your membership as a business model.
Yeah.
Well, I'll talk about how hard it is to start. So, how hard it is to start. It is very, very difficult to start when you consider that you have to, if you're going to be a telemedicine company like us, you want to be in all 50 states, you have got to have providers that have 20, 30 licenses each. So that right there is a large sum of money and a great deal of time, considering that some of the larger states, California, New York, New Jersey, like Alabama, are very slow in getting you a license. Even if you were, you did all the paperwork, paid your fee, it could be a year, it could be 2 years before you get a license. So it is a lot of time to get that going, and a lot of work to get all the licensing figured, all of the businesses figured in those states. And then dealing with the pharmacies is a whole nother beast in of itself. Because if you're going to be a company like us, you have to deal with 3 and 4 and 5, right? And each one has their own quirks about what they're good at and what they're not good at.
Right.
So they may have similar products, but you wouldn't go to this one just because they're just not good at delivering that product in a timely manner. Or this one is exceptionally fast, but this one over here does something with something else. So, it is time consuming to put all that together in a way that the providers understand it and can use it efficiently.
And, you also have to have providers that are very good at working independently. It's just the telemedicine space in general. You have to be very independent and a high functioning nurse practitioner or physician to see patients. And I was going to say, one of the other things that also really makes us stand out from these other clinics is that we do a 1-hour visit with you for your first visit, and all of your follow-up appointments can be a half hour or an hour, whichever one you choose. So most of these clinics are going to see you for 15 or 20 minutes. They're going to run through a couple of things, check a couple of boxes, and send you on your way. But we really spend time with you and listen to you and understand your goals and where you want to go. And everybody's on a different protocol, because everybody has a different goal and everybody has a different place from where they're starting. So, like Nick said, our membership is $99 a month. It does cover your hormone labs every 6 months. We can always do labs above and beyond that, if you want to, but those hormone labs are included. And you can see your provider anytime you want to make an appointment. Just say, hey, I want an appointment. We'll send you the scheduling link, and you can talk to your provider. And even beyond that, we check in with you every 60 days. How are you doing? How are your symptoms? Do you have any questions? Do you want an appointment? And then we adjust things based on how you're doing. We don't just put you on something and say good luck. We're constantly adjusting until we get you to where you want to be.
And if you remember, we also provide emergency care services,
Yep.
That are appropriate via telemedicine for a small visit fee. And we also do second opinions. So we have this happen quite a bit, where somebody will be on quite a few medications and be diagnosed or think they've been diagnosed with something, and they really don't understand it. They don't understand the medications. They don't know why their doctor put it on it, and he won't answer it why or what it does. He just says, here, take this and go home. So they will come to us. We will talk to all the people that are pertinent in the company if they have a specialty in this area, because we do have quite a few medical doctors we collaborate with, and we will give them our best second opinion.
How did you go about getting your team together? I mean, did you already know these people? Did you do recruiting?
We really looked into some great people. I did know the other nurse practitioners that work with us. We brought them from other places because they're excellent. So we knew their work ethic and, their level of knowledge in these things. So they came ready to go. We stumbled into a great physician who does a lot of collaborating for us, and she led us to a couple of other people. So we really have a good team. I called one of our docs the other day to talk about a patient, and he kept me on the phone for an hour, just, hey, we could do this, or we should look at that, or, they're really great resources to have.
And we have an eye surgeon,
Yeah.
Great guy. We kind of talked him into it, him and his wife. She's wonderful. And he was semi-retired, but he wanted to kind of keep his feet in the water a little bit. He just can't pull the trigger on the full retirement. So,
Yeah.
he's great, a wealth of knowledge. He's a wellness guy too. He was in the wellness space for a long time. So, he's great.
Yeah, Dr. Andronico, he had a clinic in Wesley Chapel in Florida for a long time, and he's been a really great resource for us.
We said in the beginning, we're not going to work with people just because we need them or we need their license or whatever. If they are not a good fit for us,
right,
we're just going to say, hey, thank you after a few months, but no, thank you. We just don't think you're a good fit with us, because there is a lot of, like Brittany said, you have to be very independent, right? And you have to subscribe to the way that we're doing this medicine.
right.
Every clinic has a different way, and our way is different than everyone else's. I can't think of a single clinic out there that does it the way we do it at all. So to have buy-in from all of those people is important. And if we don't feel like they're there, then we'll just say thank you, but no thank you, and we'll find someone else.
And another question I wanted to ask you, if someone's considering getting into this is not without its controversy. Not everyone supports supplements the way that you have gotten into them and all that you bring to the table. So what advice would you give to someone who's considering doing this?
You're talking about a patient?
Well, I'm talking about someone who wanted to start this business.
Oh, start this business.
Yeah.
Well, you have to be knowledgeable. You have to know the medicine. If you don't know the medicine, it's going to fall apart. I don't care how good a business person you are. You have to know the medicine. So you have to get higher level training. You can't just rely on, the training that you got in your regular schooling. You have to seek out the best. I've been trained by the best hormone optimization experts in the world. And it's all about the medicine, really.
And this particular brand of medicine, wellness and longevity and hormones, it's evolving every day. There is more information that comes out. I mean, literally daily. And Brittany has done a great job of putting together a bunch of different studies in different areas, because people will say, hey, well, my primary care told me this is going to cause cancer. We'll say, that's not true. And here's the study that you can take to him if you'd like. We're not going to get involved with debating with your primary care, but here's the study, right? And here's 3 or 4 studies that have been done recently that say that this is incomplete or just not correct. So we do try to arm them with information if they want it,
Right.
but we don't get into the back and forth with other providers. You know, the way that they practice medicine is on them. The way we practice medicine is our business, and we just kind of let the patient know that. And 99.9% of them after a few months are messaging me and saying how great they feel and
Yes.
thank you so much. And I can't believe I waited this long.
Mm.
I mean, a bunch of them just quit going to their primary care, although we do not advise that,
Right.
but they do. And they wind up going to us for all of their medical care.
Yeah, in fact, we had a guy a couple of weeks ago who's, you know, some of these, a lot of these providers are still just practicing hormones the old school way. They put you on 1 ml of testosterone a week and they put you on an estrogen blocker. And that is, if you have a provider that's doing that, run.
Yep.
They are doing you more harm than good. So we fix a lot of things that other providers are not very knowledgeable about. Men need estrogen, so you do not block estrogen. You know, just things like that. Providers just are, they were trained 30 years ago. They have no interest in this space. They don't get reimbursement in this space. So they have no incentive to learn about this space.
Or they are getting reimbursed for something, so they don't want you to stop it.
Right.
Right. We get a lot of that too,
Right.
where people will
Sure.
come to us and say, hey, my doctor's refusing to do this.
Right.
Well, there's no reason for them to do it if you tell them you don't want to do it,
Right.
except for they're getting a huge reimbursement from the insurance company.
We don't take insurance. And the reason we don't take insurance is because we want to treat you the way that you should appropriately be treated, not the way the insurance company says that
You should never walk out of your doctor, no matter who he is, and not understand what just happened. Right? Not understand what he was telling you, what medication you're on, why you're on it, why why this medication, why this very expensive medication this person just put you on is better than a medication that's maybe 25 years old.
Right.
Because in a lot of cases, the older medication is just as good.
Right.
But the newer doctors, they're either not educated on the older meds, they're only being educated by the pharmacy on these newer meds. And that's what they prescribe. When in reality, you can save a ton of money by just using some of these older meds that are fantastic.
Yeah.
Before we leave, I do want to talk to you a little bit about your past careers and what advice you might give someone. For example, Nick, in your case, what type of person does it take that wants to be a police officer? How should they go about building their career? Tell us a little bit about how you did it after, because you were an officer for 20 years, correct?
At 24 and some change. Yeah. Yeah. So I don't know. I don't know if I would advise it anymore. You know, the job is very different than when I started. I enjoyed it. But the way it is today, I mean, I would never say, hey, yeah, you should go out and be a police officer. But I also know that nobody would ever stop me from being a police officer. So if that's just in your heart and in your head and that's who you are, then you should do it. But be the right guy. You know, don't get into it for the look at me, you know, the badge and the uniform and the car and driving around and look at me, look at me. If that's your attitude, you are not going to last at all. Just be the kind of person that wants to go out there, help other people, and be a part of an organization that you can be proud of. The camaraderie there is worth $1 million to me. I mean, I loved every minute of it, and it wasn't always just the job; it was the people I worked with for sure.
If a person's considering it, now, do typically education-wise, do they go right from high school to the police academy?
Potentially, there are departments you can do that in smaller areas. Most of the larger metropolitan areas require a 2 or 4 year degree to get into the basic LET. But if you're in some of the smaller rural areas, yes, you can go from high school to law enforcement.
And then once you're in, you could transfer to another department?
Yeah, yeah.
Or
if you once you're certified, basic law enforcement training certified, you can jump departments if you want. So if you're in one county and a couple counties over pays more, you know, and you have a good reputation, you can get hired on, you know, at a different. And guys do that, you know, they'll start one place and they'll move around based on pay and benefits and, you know, what the atmosphere is like. You know, sheriffs are politicians. So some are better than others. And, you know, sometimes guys, you know, just don't fit in and they just want to make a change and they'll go to a PD or a state agency or something like that.
Okay, one last question for you. You know, I get this all the time where somebody comes to, they might be studying chemical engineering and are looking for a job in a hotel. And I'm like, what are you doing? So where can a young person go for their first jobs if they do want to get into law enforcement? What would be some place they could get their feet wet, so to speak?
Well, it depends on what stage of life you're in, but let's just say you're a fairly young person. A lot of the agencies will have a program that you can be a part of, including ride-alongs. I mean, anybody, any citizen, if you're cleared, you don't have a significant criminal history, you can go down to your local police department or sheriff's office and say, "Hey, I'd like to sign up for a ride-along," and they'll get you on a schedule, and you'll do a shift with somebody, and you can kind of see what goes on, at least, firsthand.
Wow, great information. Thank
And they
you for
also
that.
have some pretty good recruiting officers in most departments now, that will really help you to make a decision whether this is for you. They'll go through the pay, they'll go through all of that stuff, but they'll send you on a ride along. They'll let you talk to some of the guys, and really they don't want somebody that's not going to work out, right? So
Oh, sure.
they're as careful as they can be as to weeding people out that they don't feel are going to make it. And it behooves both sides to take some time and figure out, hey, is this for me, and is this person right for us? They do a pretty good job of that these days.
Great. And Brittany, I know a lot about your journey, but you, I mean, you worked in a children's hospital, worked all kinds of shifts. Tell us a little bit about, if somebody's interested in nursing, how to get
Yeah,
started.
so, nursing is a lot of school. You have to start there. There's really no way around it. Um, I'd always recommend to people that if they're going to go to nursing school, get your RN, BSN. That you're going to have a thousandfold more job opportunities if you have that RN, BSN. And then if you want to go beyond that, then you would choose a specialty. I generally tell people to choose family medicine because it gives you the most broad job opportunities. You learn about children, adolescents, adults, everything. You're not pigeonholing yourself into just pediatrics or just adults or just mental health or whatever. So I have 2 board certifications. One is in family medicine, one is in emergency medicine. Emergency medicine is really my true love. It must be the adrenaline. But I love this because we help people every single day. And that's what I love about it. And I always tell Nick, it doesn't feel like a job. It never feels like a job if you're doing what you love, right? So it doesn't feel like a job to me. I love it. And our patients are so grateful. So anybody that is wanting to, start a business or get into medicine, it's very, very rewarding to be able to help people. Just don't get stuck in that, pharmacology cycle where all you're doing is giving out drugs. You have to really understand the medicine.
For sure. And just jumping back to what makes, I was just thinking, you can contact us literally almost 24 hours a day. You can message in and you will get a response. It may take till the morning to get an appropriate response, but somebody will acknowledge, hey, we got your message. And the communication between the patients and us is, I mean, they have total access almost all of the time. I would say 90% of the patients have my personal number.
And I'm not sure we recommend that.
Or because I've talked to them myself.
No, it's been great. I mean, they can always call him.
At least 90%, right? I mean,
especially the cops, all the cops.
Yeah.
So if they have a question and they just want a quick answer to something, they'll shoot me a text and I'll get it for them and shoot it back. And that's the service we provide. It's not your typical medical service. We call that concierge service because that's exactly what it is.
Great. And Brittany, also young people, I know there's a plethora of work they can do while they're learning or trying to decide if this is a career for them in nursing. I mean, hospitals and doctors' offices have a ton of entry-level positions. Is that correct?
Absolutely. My very first job in medicine was working after hours and on weekends in Dr. O'Brien's office, just filing, when they weren't there, so that they had all their stuff ready for the next day when they came into work. And believe it or not, I actually learned a lot, you know? So there's always opportunity for just getting in the door, and then you can talk to people, you can decide what area of medicine, because, you can't know it all. It's too big.
Right.
So you got to kind of decide where your real passion lies, and then you seek more and more opportunities in that particular field. Like for me, it was emergency medicine. Once I got on that track, it was, like gangbusters.
Right. You also worked in a vet's office as well, right?
I
Vet
did.
hospital, right?
That's true. Actually, my first medical job was working veterinary medicine, which I did for about 10 years. So I actually had a lot of medical knowledge by the time I went to nursing school, just because of that experience. So yes, I forgot about that.
Yeah, see, great. So Nick, to your point, what is the best way for someone to get in touch with you if they want to discuss telemedicine and what you offer?
If you come to our website at No Limits Medical, there is a tab on there for a free phone call. You will probably get me, most likely, and I will go over any questions you might have about what the process is for becoming a patient, what it looks like, the services we provide, and just try to answer any questions they might have. I'm not a medical professional, but I know this. I know the system and our process. So that's 90% of the questions you get. People just don't understand how to be a patient yet, so I just kind of walk them through it.
I love that, how to be a patient. So you've got your website. I know there is also, you have a video on YouTube. You'll have this one, of course, but there's another one where I've forgotten the lady's name interviewed you, which is very informative, so they can watch that as well.
Yeah, that's our coach, Courtney
Yeah,
Cash.
and Courtney
She's
works with us. She's an amazing RN. She knows the longevity and wellness space as good as anyone.
Yeah, and she is actually married to a longevity expert,
PhD.
PhD in longevity. So we have a lot of really, really high level resources at our disposal, which is great.
And I'll give you the last word. What would you like to say to our audience today?
If you are looking for healthcare that in your mind you think you're getting, right, but you're not getting from your primary care, then you should come to us.
I like that.
Well, people have this idea that their doctor is going to take care of them. It's going to be a great relationship. Everything's going to be fine. And that's just not the way it is. People walk out of there very disappointed, misinformed, or just don't know what's going on. But with us, you have that level of care. I mean, you can contact us anytime. If you don't understand something, we will explain it to you 10 times, and we do that on the regular. We provide a service that really no one else does. It is true concierge medicine.
And, I'm always happy to talk to people who are interested in getting into medicine. They want to be a nurse, or they're thinking about going to nurse practitioner school. I can give tips, about questions they might have. I've done that for a lot of people. And people, it's always satisfying when people come back to me and they say, oh my gosh, thank you so much for, steering me this way, because this would have been a big mistake, So it's always nice to talk to somebody who's kind of been around there. And Nick does the same for people who are thinking about law enforcement or are just new in law enforcement.
Great. And Brittany, I know you have a string of letters after your name, and you're also a PhD, I should mention as well. So you really have delved into your profession, and Nick, I know you have as well. Thank you so much for being on the show today. You have given us some great advice, and offering people alternative medicine is a great service. Thank you so much for your time.
Really appreciate you having us.
Thanks for having us.
Thank you for watching Business Notes. We've been speaking with Brittany and Nick Persland, owners of No Limits Medical, a company specializing in hormone optimization, sexual health, weight loss, hair restoration, and anti-aging solutions. I'm your host, Diane Bogino, bringing you business ideas you can bank on.